Okay, so this is very typical scenario that you see in your exam. It is very important that you understand the nature of this exam. Your station says, do not take the psychiatry history. This is very important that you do not take the psychiatry history. This is clearly a scenario where a young patient has come to you in the hospital in the A&E department, brought in by ambulance with a history of drug overdose. Uh, they say take the blood samples. So, what is more important for you to understand in this situation? This is someone who may not speak to you. The patient is very quiet. When you go and try to speak to the patient, they do not speak. Okay, you do not need to worry about that situation. Okay, if the patient does not speak, simply say I will come back to you later. But at the moment, what is more important for you is to take the blood samples without any delay, because the patient may develop hepatotoxicity, the patient may develop liver failure. Okay, so that is why it is very important. Most of the candidates fail taking the blood sample because they keep asking the history. So taking the history is not so important. Okay, they start referring the patient to the psychiatry. They start offering the patient um, multiple sports and stuff like that, which is not important according to the situation. You need to focus what is more important for you at this point of time. uh, when you go in the GMC exam, the simulator is very quiet. He wouldn't tell you, he wouldn't say you anything. So the approach to this situation is simply go with your task. So it says, please go to Mr. Younglow, talk to him, discuss a management with him, and perform the necessary blood investigations. What are the necessary blood investigations? This is very important for us to understand. What can happen if a patient takes any drug overdose? The patient can develop multiple toxicities, including the renal toxicity, including hepatotoxicity. These are the important things. So, the most important among them all is hepatotoxicity, because paracetamol poisoning is very common, paracetamol overdose is very common in the UK, and the patient can develop liver failure. What can go wrong with this patient? It can cause deranged liver function test, as well as it can prolong bleeding time. It can derange INR. So you need to focus on those things. So always make sure that you check those bloods. So what they will be looking at you in the station, the trick about this station is whether you have the insight to the situation and you do the blood test, or you just continue offering the chaperone, offering the confidentiality, and you just are waiting for the patient to give you the consent, because this patient is in a different state of mind. He may not be uh, responding to you because he is worried, he is depressed, and he is not happy, and he is not ready to. This is someone who has attempted to suicide or to harm themselves. Okay, they are from a different world. Their thoughts are not with themselves. Even even if apparently on the street questioning they look normal to you, they have full GCS 15, it does not mean that they are fully compass mentis, because they need the support. They are the vulnerable patients, so we need to offer them the support whatever we can. So the best support at this point of time is to perform the blood test to make sure that no organ damage has occurred for this patient. Okay, that is the best support that we can do. And if the patient is not ready to talk to you, do not worry. We always can go back to the patient. We still have the time. Now, taking all the mini components of the scenario into account, talk to the patient. What are we going to talk? We want to talk to the patient about what he has taken, when did he take, and what was the intention. This is what we want to know. Okay, so we want to find out what medication did you take. Did you take with the water? Did you take with the wine? What time did you take it? Was it just one single type of the medication or more than one? Okay, and do you did you intend to kill yourself or harm yourself? So sometimes these are two different situations. A patient may still want to live, okay, and they want to just harm themselves. They do not want to kill themselves. That's a different situation from killing and harming. Okay, so ask them, what was your intention? Sometimes why the patient may want to harm. A few times you may see the patient coming with the bad thoughts, or they just want to penalize themselves, maybe thinking that I broke up with my girlfriend, and because I feel that it is my fault and I want to punish myself because my girlfriend is not talking to me, or my wife has left because of my fault, and I want to just punish myself by doing that, but I still want to live. Okay, sometimes the patient may say, oh, I don't want to live at all. Okay, so punishment may need psychological support. Okay, but not the admission. But if someone says, I want to die, it means this patient needs admission as well. Okay, this is more critical than someone who is just going through the difficult time. So we can offer them support by putting them to the mental health team, to the psychological support, and asking them to speak to the friends and family. But for those who are not willing to live at all, so they will need more critical management while inpatient. So that's why it is very important for you to understand. So a few typical questions that we want to ask this patient are, what did you take? What did you take with? And did you take one single type of the medication or more than one? What did you take with? What time did you take it? And what was your intention? Okay. And then, did you have any symptoms at the moment? Okay, so the symptoms that this patient can have are epigastric pain, can feel nauseous, and can be vomiting. So the most alarming thing, if the patient is vomiting, make sure that you ask them, did you vomit any blood? Because a patient, this will tell you about if the patient has developed any trauma from the vomiting, some forceful vomiting, as well as any prolonged bleeding time and the clotting profile derangement. So that's important. This is a combined station. We are going to split our time into 2 minutes, 4 minutes, and 2 minutes. The scheme for all the combined stations is 2 minutes, 4 minutes, and 2 minutes. We will not spend more than 2 minutes in the beginning, and by the end of the 2 minutes we should be able to, or we should actually start collecting all the material to take the blood sample. Okay, the initial 2 minutes are just for the history taking. Take the focus history. Patient usually will not talk to you. I keep stressing on that. Keep this in your mind. Do not be surprised if your patient, when you go in the exam, if your patient is not talking to you. Okay, do not be surprised. And no need to offer. The examination scenario clearly says do not take psychiatry history. Okay, so the people who start saying, would you mind if I take the blood sample, and can you can tell me what are you going through? I can see that you are upset, and I can reassure there are many sports that we can provide, and these things are unnecessary. You will waste your time in offering all those things. This is not the purpose of you. Okay, so just spend 2 minutes in asking those questions. If the patient does not speak to you, you can simply say, Mr. Lowe, I can see that you are not ready to talk to me. I'm really sorry. I'm happy to come back to you later. At the moment, I want to take a few blood samples of you, making sure that whatever you have taken has not caused any damage to your liver and to any other body organs. Okay, and for the purpose of this examination, this procedure, I need you to be bare below your elbow, and I want to take blood sample from your preferred arm. Okay, during this procedure I will be looking, I will be tying your arm with the rubber band, feeling your vein, and there will be a sharp scratch. I will make sure that I remain gentle. Okay, and then no need to wait for the verbal consent. Most of the time this patient gives you the consent just by raising their eyes only. Okay, so he will make eye contact. Most of the time this patient does not make eye contact with you at all. That is very important. Okay, so try to establish good rapport. You can sit down and you can try to create from different angles. You can sit in front of the patient and see if the patient is ready to talk to you. But if the patient does not speak to you, do not worry about, just simply move forward, start explaining what you are going to do. And then the next thing is collect the right bottles that you need. The bottles that you need for this patient are one yellow top, one blue top. Yellow top is for the biochemistry, that includes the UNEs, LFTs, and CRP, as well as paracetamol levels. Then you need a blue top. Blue top is for the coagulation profile, PT-INR. Make sure that you always check PT-INR, coagulation profile. So your examiner will be looking at you, what bottles, what color bottles you are picking. Okay, that will be considered as a data gathering. So you need to make sure that you do not miss that. And you need one purple top, that is for the full blood count. And if you have if you see pink top bottle is placed, is available, pick that one as well. That is for the group and save. Okay, and in addition to all those four, you also need the VBG minimum if you are not doing the ABG. Okay, so you need the venous sample for the blood gas. Okay, you can say ABG or VBG, does not matter. So you need 5 different stuff, different collecting stuff to take the blood sample. One is a gold top or yellow top for the full for the biochemistry, paracetamol level, and for the liver function in CRP. You need one blue top for the coagulation profile. You need one purple top for the full blood count, and you need one pink top for the group and save, and you need ABG and the VBG. Mention that. Many of the time it is not there, but the examiner asks what else you will need, what other blood tests that you will do for this patient. So mention that I will do arterial blood gas or the venous blood gas. Okay, so then is the procedure. The procedure is very simple. You guys have done that so many times. After you explain this to the patient, collect your material before you start. The material that you need is a tourniquet. Okay, that we have on here, and we will need Vacutainer. Okay, we will need this bottle, blue top. We will need purple top, and you will need 2 more. One is a pink and the yellow top, which we do not have at the moment, and we will also need a VBG syringe. Okay, venous blood gas syringe. And in addition to that, what else we need is the cleaning alcohol wipe, as well as gauze to put on after you take the sample, and a little tape. Okay, to just stabilize. The first thing that you want to do is, after you've collected, after you've prepared your tray, you are going to apply the tourniquet. Okay, making sure that the patient is sitting comfortably. Okay, apply the tourniquet. And feel the vein. Okay, look for the appropriate vein. Then untie the tourniquet. This is what usually guidelines say. So you apply the tourniquet once to feel the vein, then you untie it so that the patient does not develop any complications from the prolonged application of the tourniquet. Okay, so then you clean the vein. Okay, so you applied the tourniquet once, then you felt the vein, untie it, clean it. So clean it in a circular fashion for 30 seconds and let it air dry for 30 seconds. This is the rule. So clean for 30 seconds, air dry for 30 seconds, wait for 30 seconds, okay? And then reapply the tourniquet. Okay. Next that you want to do is just warn the patient of the sharp scratch now. We are ready to take the blood sample. Okay. Now warn the patient, hold on to the skin, making sure that you do not touch the area that you've already cleaned. Okay. Warn the patient of the sharp scratch. Ready, please. Sharp scratch. And needle goes in, and then you connect the bottle to the vacutainer. Now you can see the blood is coming. Okay. The blue top bottle is now full. So only with the blue top, you need to make sure that you fill it only with the blue top. For the others, you're not bothered much about the amount. Okay, you can take half of the bottle, but blue top should be full. Okay, then the next sample, and so on. So you complete your sampling. Take one gold top, one blue top, one purple top, and if available, one pink top. Okay, after you've done that, you untie the tourniquet first before you remove the needle. Okay, and take your gauze piece, put on here, and withdraw the needle slowly and gently. Okay, making sure that you do not see any blood coming, and pull this needle back. Okay, so the needle is now covered, and apply a tape on here, label all the bloods and send them to the laboratory. That's all, the job is done. Okay, so a quick recap of the steps: apply the tourniquet on the preferred arm, look for the vein, untie the tourniquet, clean it, apply the tourniquet back, then sharp scratch, take the blood sample, next blood sample, next blood sample. After you've done all of them, untie the tourniquet, and then you remove the needle. Okay, the job is done. So you are now going to enter the last 2 minutes of your station. Your examiner asks you, what are the blood samples that you want to take? What are you worried about? So you mention all of them, all the blood samples that you've taken, and what are you worried about? My main worry in this patient is the liver failure. I want to make sure that the patient does not develop any hepatotoxicity, because the high dose of paracetamol can cause liver failure. Okay, so how are you going to manage this patient? So the management includes uh, starting the patient on N-acetylcysteine after waiting for the blood results if the patient's paracetamol level is higher. Okay, the question that the examiner may ask you, okay, very good. Now you tell me in what situation you will start the patient directly on N-acetyl without waiting for the blood results. The situations are if the patient has taken very high dose of paracetamol, okay, which is more than 24 tablets of 500 milligram paracetamol, okay, and if the patient has taken staggered dose, if the time of the intake of the paracetamol is unknown, if the patient has taken with alcohol, in those situations we start the medication N-acetylcysteine without waiting for the blood results. Otherwise, we normally wait for 4 hours. Okay, any question? Okay, excellent. So we are done with this.
When you're removing the blood sample and you're changing the tubes, is there blood flowing in between?
No, no. So this tube, this vacutainer has uh, a rubber on the top. If I can show you on here, you can see this rubber protects the backflow of the blood. Okay, it does not allow the blood to come out. Otherwise, it has a needle hidden inside. You can see the needle. Okay, this little needle is hidden. Okay, uh, that's all about it. And sometimes you may see different needle. You may not get the vacutainer. Okay, so this is also very important. You may not get this butterfly and the vacutainer like this. You may find stuff placed like this. Okay, so this is an alternative to the vacutainer, to the butterfly. Okay, uh, it needs a bit technical understanding of how to use it. Okay, many of the candidates, when they find different material that they have not used ever, they struggle. Okay, they waste a lot of time and they become anxious and worried about all those things. So it is very important. Some of the time they use this as well. Okay, not all the time butterflies. So how you can use it? This is you have to make a vacutainer. You have to assemble them. It has a seal. It has this seal in the middle. Okay, it has two parts. One is a needle and the other one uh, is the rubber part that is covering the needle inside, that goes on the vacutainer. So you simply rotate it, okay, to break the seal, and you pull them apart. Okay, what it will do is it will uncover the needle end, and then you bring this cup on the needle and close it. After you have tightened it, you remove this. Okay, so it will make you vacutainer. So it goes directly into the vein. Okay, does it make sense? Any question? Any question? No. Okay. So this is something that may be surprise for you in the exam. So do not be surprised if you see such stuff. Okay. I have actually seen a few candidates who struggled and they said that they failed eventually because they never used it.